Hi, I'm David. Welcome to Asian Hospital and Healthcare Management. You know, healthcare is changing faster than ever. New technologies, smarter hospitals, digital tools that make care more personal and precise. And here, we're bringing you the stories behind those changes. From frontline innovations to leadership insights, we'll meet the people and ideas shaping the future of healthcare across Asia and beyond. So whether you're a hospital leader, clinician, innovator, or strategist, grab your coffee, get comfortable, and join the conversation. Want more? Subscribe at www.asianhm.com/subscribe and stay connected anytime, anywhere. All right, let's begin.
Hello and welcome back to Health Impact Voices, the podcast that explores how visionaries across the world are shaping the future of public health. I'm your host, Daniel Ross. Today, we're joined by Dr. Salomea Guchmazashvili, National Consultant at the World Health Organization and founder of the Public Health Consultancy Hub Georgia. She's been a driving force behind efforts to strengthen local health systems, mentor future professionals, and advance evidence-based policymaking across low and middle-income countries. Dr. Salomea, welcome. It's such a pleasure to have you here.
Thank you, Daniel. I'm very glad to join this conversation today.
Let's begin with a broad question. How do you define public health leadership in the context of transforming health systems in low and middle-income countries?
That's a great question, Daniel. Public health leadership in low and middle-income countries is defined by the ability to drive systemic change through evidence-based vision, local adaptability, and strategic stakeholder engagement. It involves mobilizing cross-sectoral collaboration, building resilient health systems, and ensuring equity and accountability at every level of decision-making. Effective leaders in these settings must not only interpret data but also translate insights into actionable policies that resonate with local needs and realities.
That's a powerful definition. Now, I'm curious that in what ways has your work demonstrated the power of integrating local expertise into broader system-level health strategies?
Absolutely. Integrating local expertise has been central to the design and implementation of community-informed health initiatives. At the World Health Organization country office in Georgia, national collaborations have leveraged the insights of epidemiologists, frontline workers, and civil society to improve uptake of rehabilitation and long-term care models. These contributions have enriched policy dialogue and ensured health strategies reflect both scientific evidence and sociocultural realities.
That makes so much sense, but I imagine there are some real challenges there. What are the core challenges you've encountered in aligning national health policies with the real-world needs of underserved communities?
Yes, and it's an important point. A key challenge lies in the disconnection between policy design and grassroots realities. Bureaucratic inertia, fragmented health information systems, and limited community involvement often hinder alignment. In practice, this results in underutilized interventions or inefficient service delivery. Bridging this gap requires mechanisms that embed community feedback into policy cycles, supported by capacity building at subnational levels.
I love that idea of feedback loops. Let's talk about data. It's such a buzzword, but in fragile health systems, It can literally save lives. How can local epidemiological data be used more effectively to drive evidence-based policy?
You're absolutely right, Daniel. Local epidemiological data should serve as the backbone of policy design, yet its utility is often limited by poor quality, fragmentation, or delayed access. Strengthening health information systems, investing in digital registries, and training data interpreters at local level are critical. In Georgia, the integration of thyroid cancer registry data into public health planning has enabled targeted interventions and refined population risk profiles.
That's a great example. Could you share a specific instance where your leadership directly contributed to measurable improvements in health equity or outcomes?
Of course. Leadership in a WHO-supported project on healthy aging and rehabilitation services helped expand access to assistive technologies in rural Georgian communities. By applying a needs-based approach and engaging local health workers, the initiative increased the utilization of assistive products and improved functionality scores among older adults, a key indicator of equity in care access.
That's incredible. Now, how do you navigate the balance between international public health frameworks and the cultural nuances of local health ecosystems?
That's such a crucial balance to strike. Navigating this balance involves contextualizing global frameworks such as universal health coverage or the WHO Rehabilitation 2030 initiative within national traditions and health-seeking behaviors. Cultural adaptation, co-design with community actors, and continuous dialogue are essential. Success is measured not only by implementation fidelity but by relevance and sustainability in local settings.
In your experience, what role does mentorship play in shaping future public health leaders capable of driving innovation?
Mentorship is a cornerstone for cultivating leadership, particularly in environments where formal training pathways in public health are limited. It accelerates knowledge transfer, builds confidence, and enables experiential learning. Through supervisory roles and workshops, efforts have been made to guide young professionals, particularly women, into leadership positions where they can drive transformative health interventions.
Let's shift gears a bit. Your consultancy is doing some really interesting work. How can public health consultancies like yours act as catalysts for systemic change in countries with limited healthcare infrastructure?
Yes, that's something I care about deeply. Consultancies provide agile, needs-responsive support that complements institutional capacity. By combining technical expertise with project management, public health consultancy offers tailored solutions for health planning, policy design, and research dissemination. Such entities play a catalytic role in piloting innovations, bridging global-local gaps, and building sustainable models of change in resource-constrained settings.
Let's talk ethics, a topic that doesn't get enough airtime. What are the ethical considerations when applying global research standards to local public health research in low and middle-income countries?
Yes, that's an area that needs constant attention. Ethical concerns include the risk of imposing external norms that may not align with local values or infrastructure realities. It is crucial to ensure informed consent processes are culturally appropriate, data governance frameworks protect community autonomy, and research priorities are co-developed with local stakeholders. Capacity building and ethical review boards is also essential for safeguarding participant rights.
Beautifully said. How do you ensure that public health innovation remains inclusive and addresses the unique needs of vulnerable populations?
Inclusivity is embedded through stakeholder mapping, community co-creation, and disaggregated data analysis. Innovations must be evaluated not only for efficacy but for accessibility, affordability, and acceptability. Projects involving assistive technology, for example, have been tailored to the specific mobility and communication needs of persons with disabilities, ensuring equitable service delivery.
You've also done a lot of cross-sector work with the WHO. Tell us, how do you get different ministries and sectors to collaborate on health resilience?
That's a great question, Daniel. Health resilience requires intersectoral action. Through WHO coordinated platforms, engagement with ministries beyond health, including education, social protection, and labor, has been prioritized. Joint planning in areas such as long-term care and healthy aging has enabled shared ownership of outcomes and improved continuity of services across sectors.
That's such a smart approach. Can you discuss how reproductive health and thyroid cancer research are shaping broader conversations about policy innovation in Georgia?
Ongoing registry-based research on thyroid cancer and reproductive health outcomes is shedding light on gender-specific health risks and informing national screening strategies. These findings are contributing to policy dialogues on women's health, occupational exposure, and endocrine disorders, highlighting the value of integrating epidemiological evidence into reproductive health planning.
What systemic shifts are most urgently needed to transition from reactive to preventive health systems in low-resource settings?
Exactly. The shift requires a recalibration of health budgets towards prevention, expansion of community-based services, and integration of health promotion into primary care. Digital health tools and mobile surveillance systems can facilitate early detection. Policy incentives must also align with prevention, rewarding long-term population health outcomes rather than short-term service outputs.
Finally, what vision do you hold for the future of public health leadership, and how do you see local expertise shaping global health narratives?
The future of public health leadership lies in decentralized, culturally attuned, and data-driven approaches. Local expertise must no longer be viewed as supplemental but as central to shaping global health narratives. Empowering regional voices, particularly from low- and middle-income countries, is vital for ensuring global health strategies are inclusive, grounded in lived realities, and responsive to the diversity of the human condition.
That's a wonderful perspective, Dr. Guchmazashvili. A strong reminder that meaningful innovation begins with local insight and leadership. Thank you so much for joining us today and sharing your experience.
Thank you, Daniel. It's been a pleasure.
And to our listeners, thank you for tuning in to Health Impact Voices. If you found this conversation insightful, be sure to subscribe and share it with your colleagues in global health and policy. Until next time, stay informed, stay engaged, and keep pushing for healthier communities everywhere.